Paragamian, CEO of Health Monitor Network, and I'm joined today by Dr. Julius Wilder from Duke University, a gastroenterologist, a professor of medicine, and you've been the chair of the Diversity, Equity, and Inclusion Committee at Duke University School of Medicine. So anxious to get into some conversation. Thank you for being with us today.
Yeah, no, happy to be here and excited about our conversation today.
So at the highest level, the whole topic of health equity, health literacy, certainly has been very prominent of late, but I know that that's something that has been a passion of yours for a long period of time. As you track that arc of progress, what gets you excited about where we are now in that journey?
Yeah, you know, you highlighted that some of us have been doing this work for a while. This idea of knowing the importance of how we frame issues around health and how we bring them to the community to ensure that they understand and are engaged is not necessarily a new thing. But what really excites me is the point you just made. It really has become something that is a point of emphasis now in a way that it was not before for various health systems and health entities that are interested in engaging and improving health outcomes. And I think the more engaged these entities become, the better outcomes we're going to see because of the improved health information we're going to be providing our communities.
Right. And you touched on health information, which certainly is the reason that we as a company wanted to connect into this. And as you know, and for the audience, we as a company made a contribution on a 3-year grant so that you could, with your colleagues, study healthcare communications, the different manners, modalities of healthcare communications and how it impacts particularly underserved communities. We're about a year into that 3-year longitudinal study. Tell me a little bit about some of the early things that you've been doing and the things that you're excited about.
Yeah, you know, first of all, I want to say thank you. There are not many people, leaders, people in industry, health entities that are interested in really understanding these issues and are willing to not just talk about it, but actually, you know, let's be real, you know, put money into it. Right? That's how you really know, a person's commitment, a company's commitment, and I actually really commend you all and thank you for that.
Our pleasure.
And it's important that you understand that there's already been tremendous benefit, certainly within our community, because of the contributions you guys have made to this work. You know, we're really excited. We have really looked at a number of different spaces around how to improve health literacy, with a real emphasis on leveraging that to improve health equity outcomes. And so there are, for example, a large organization here in the Durham area that focuses on care in Latinx communities. And with these resources, we were able to help organize their various community engagement and health literacy events and ensuring that they actually have proper translation, right? So simple things like that, you know, and it seems like something that's common sense, but if you don't have the resources and the expertise, you know, you really are not prepared to provide these entities, these communities, what they need. And so we're really excited about that potential project and what it's meant to that community. Another great example of the work that we've done is understanding that, you know, there are a lot of food deserts. We know the importance of healthy diets and how that can drive a lot of, unfortunately, you know, adverse health outcomes. And so we actually were able to engage in nutritionists and actually now in 2 separate large community-wide events, invite community members in, provide them healthy eating options where the nutritionist actually cooks food for them. She teaches them about how to cook in a very healthy way, meals that were very heavy in terms of vegetables and fruit. There's just some tofu there, which, I'm all about the meat, but there was some tofu that was pretty good. And again, just an opportunity for the community in their space and in a way that is engaged and in a way that they can understand and really connect. We're able to learn about how to eat better and live better. And then when you think about what's happening in those 2 spaces, you're talking about things that are not like one-time things, but those are the kind of things that you can do in a community that can have a lasting impact. You know, how they eat is not just going to impact their diabetes right there in that moment, but will have an impact on their diabetes, their high blood pressure, you know, their cholesterol moving forward in numerous ways and for a prolonged period of time. And so those kind of sort of projects have been really, really great. But I'll say we're also excited about going the other direction as we've looked at what can we do for providers so that we learn more about health literacy, so that we as providers in our day-to-day engagement with our patients, how can we do a better job? And we actually now are looking at a series we're going to provide for our GI division, where we focus on health literacy and health equity and begin to engage us to help us understand more about these issues and take better care of our entire community.
you touched on a number of threads I'd love to pull on. Obviously, one of them was speaking to people in the language that they need to be spoken to, and making sure that the medical vocabulary, which is difficult for everyone,
Sure.
and particularly if it's not your first language. But you've also talked a little bit about where people hear the messages. So whether that's in a community, or even on social media, which I find fascinating. I know that some of the work that you've done over the past year led to an abstract that was presented at the American College of Gastroenterology. Tell us a little bit about that, because I know that was exploring the influence that TikTok could have in terms of activating real patient behaviors.
It's interesting, we have seen this tremendous growth of social media. And to your point, many people go to social media for information. And we were interested in understanding more about what that looks like. And in this case, from the perspective of colon cancer screening and understanding colon cancer and beginning to sort of decipher what's out there, misinformation, what is folks' understanding of sort of colon cancer and colonoscopies and screenings and whatnot. And it was really interesting to see that, number one, there's a lot of information out there on TikTok, and not just colon cancer, but various sort of types of health issues that are out there. The people speaking about these health issues, some of them are individuals who are professionals, providers, and so forth and so on. Some of them are just individuals who have experiences in their lives. All of them have important messages that they want to share. Some messages are more accurate than others. And so what we were able to show is that, particularly in the case of colon cancer, where you've seen a lot more younger people with colon cancer, we were able to show that, number one, there is a lot of conversation about it. Not all that conversation is accurate conversation. And in fact, oftentimes the individuals who get the most attention, so to speak, depending on how you want to measure it, likes or reposts, those kinds of things, are individuals who are not providers or physicians, but people who are influencers, people who've had a voice, or people who have a story that's very compelling. And so we need to think about how to leverage that space to use it as a tool that could potentially be very powerful and helpful around the issue of health literacy.
And you brought up influencers. So as you said in that abstract that was presented at American College of Gastroenterology, the influencer may not be a man or woman in a white coat. The influencer may be someone else. Can you talk a little bit about, in the work that you're doing and the work that you hope to be doing, I think we've talked about that you're going to look at a variety of influencers that can shape people's behavior in communities that are, very disparate right here in the Triangle area. Tell us a little bit about that.
Yeah, absolutely. More and more the individuals who are, for instance, social media are not, people who are necessarily physicians or providers, but they have tremendous voice, and they have a number of individuals who are engaged and listen to what they say. What we are looking at is thinking about how we can partner and engage these types of individuals to provide more accurate health information, and to think about ways to grow an interest in really sort of appropriate health literacy and very accurate health information in a number of different areas in terms of health outcomes. Also, in that same setting, we need to think about them as examples for health sort of providers or even institutions to do a better job of being influencers ourselves in that space. In other words, how can, for example, Duke School of Medicine be more of an influencer on social media to perpetuate positive, accurate health information? When we reflect on COVID, one of the scariest parts of it was that, and this is both in social media and the lay media, like a lot of misinformation. But if we, from the beginning, are active participants in social media, and we're doing it the right way with the right information, we can prevent that same thing from happening again, down the road.
And recently, I know at Duke you presented some work that you've done relative to community-based activities and leveraging community leaders so that while you and Duke University and perhaps some of the benefit of this grant were behind the curtain, it was the community leaders who took the center stage. Tell us a little bit about how that impacted behaviors and what you're excited to see pull through there.
Yeah, and that's a really important point that you make there. There's always going to be sort of a bridge, so to speak, in terms of trust and engagement with the community, particularly for large health systems. So the question becomes, how do we embed ourselves in the community, provide them the health care and health information that they need? But most importantly, how do we do it in a way that's sustainable? And really probably the best way to do that is to engage their leaders. To, like we were talking about, sort of influencers on social media, who are the individuals within the communities that are the influencers, the leaders, the people who have a trusted voice in that space. How do we partner with them in that space? Define what their health sort of priorities are, and then work with them to build an infrastructure that addresses that health priority both now and in a sustainable way moving forward.
And certainly the people that we work, the pharmaceutical advertisers that we work with, I keep thinking in my mind, there must be an aperture downstream that we can help them with materials that are more appropriate in the right language and in the hands of local people. Is there any, as we look ahead to the future, anything you can predict here for us that we can help these companies that are very well intended, that want to put the patient first, to be able to think in that very personalized way, that the information that patients may need in urban Durham, North Carolina is different than what patients may need in El Paso, Texas, and getting the right information and the right materials to these patients. Any thoughts or guidance you could help us with that we can take back to our clients?
Yeah, so first of all, you're asking that question. And that's the first key start. To begin to think about how does this message, in terms of just the health information or perhaps clinical trial engagement, how does that change depending upon the health issue in the sort of populations or patient populations you need to engage? And then linking that to the individuals in those spaces, the community partners that you can begin to engage with and build a campaign with, to think about clinical trial participation. You know, for example, we have a group here in Durham that I work very closely with. They call the AME Zion Heal Group. And they have a sort of large network of AME Zion pastors. And they are fantastic. They've been trained in clinical research. They understand the basic sort of fundamental issues around how to engage in clinical trials. And then they are now partners in our ability to engage the African American AME Zion community across North Carolina, where they are sort of the partners helping design the clinical trials, helping us think about how to engage that population, helping with recruitment of that population, providing feedback on that process as we kind of go through it. I mean, that is where I think we're going to need to go. Those kinds of partners, where we provide them that kind of training, and then we work with them as a true partner as we engage in these various spaces. Now, here we're talking about clinical trials, but it could be around a health campaign or something else like that, depending on what your goal is.
No, it's certainly one of the reasons why we as a company, and I was so personally excited, is that what we all want is a better outcome for the patient. And what we're talking about is something way back here in the funnel, which is how do we even find, as you say, the right patient to make sure that we have the right demographic representation in clinical trials, which has been such a burden for the industry for so long to get that. And that's something that is years before a drug is even commercialized, but we need to start somewhere. We need to start way back in the funnel. I'm wondering, in the years ahead as we collaborate, are there any particular projects that you're really excited that you want to share about today? And I'm thinking particularly about ways that we would be reaching some of these folks to get them into trials, or other underserved communities here, because one of the things that I know you impressed upon me was that right here in this part of North Carolina, there are a lot of underserved communities that are very demographically different. So they may be 20 miles apart from one another, but their needs for information and access are so varied. So let's talk a little bit about what the leaning forward looks like that you're excited about.
Yeah, you know, right now we are exploring ways to build sort of a central hub here in Durham, where through leveraging networks with our community partners, as well as partnerships with community health workers, we begin to place these sort of the central office here in Durham, but have these sort of nodes in these spaces of interest where we feel that there is a gap in terms of health care or health equity or health literacy. And in those sort of nodes that we place around the Durham area, beginning to, first of all, work in those communities to understand what their needs are. And then from the central office here in Durham, in partnership with our work here at Duke, to provide the resources that they need to do what they feel they need to do in the way they feel they need to do it. And the reason why we want to take that sort of approach with it is that, to the point you just made, it's going to vary depending on where you are. You know, what we do in sort of rural areas just east and north of Durham will be very different from what we do in central Durham City or Charlotte or something like that, or Raleigh. There may be similar health issues, but the mechanisms and how they drive the health inequities or the health disparities and the adverse health outcomes can be very different because of where they are and who they are. And so we're working on looking at that network and building that network in a way and again, in partnership with leadership in terms of both sort of government leadership in those spaces, like the county health departments, as well as the community partners and voices there, so that we build something that's very sustainable in that setting.
I'd love to do a bit of a lightning round, to borrow from our friends on television, on just a couple topics. As a clinician, as an educator, and as a passionate advocate for all of this, I know you see patients that come in armed with information, and I use information in the proverbial quotes,
Yeah.
information that they've gleaned, whether it is from social media, whether it's from the broadcast television advertising that pharma companies do. Tell me a little bit about some of those channels and the good and the bad that you see in all of that. I know that, like anything, it's complicated. There are things that are very hard to say, this is good, this is bad.
Yeah.
It's very nuanced, but tell me a little bit about some of the positives and the downfalls to some of those particular communication channels. I'm thinking specifically about broadcast and social.
Yeah. Sure. Yeah, it is a issue that we navigate as healthcare providers now that we really didn't have to in the past. So what you're speaking to right now is a very prominent thing that's relatively new to us. And sometimes your patients in there speaking on things that make, from a clinical or sort of medical sort of point of view, that are clearly wrong. But what I would say is that if they have taken the time to look something up, to engage in the topic and try to understand even more, that's a good sign, right? That's what we want all of our patients to do. And so whether they're right or wrong necessarily, that's an important moment for me as a provider to, first of all, understanding, what they know at this point, providing them some background so that we can course correct if needed, and ensuring that they have a good, thorough understanding of what the current health issue is that we're dealing with for them and what the plan is moving forward. And I always say it's great that you look things up. This does make sense, but let me sort of provide a little more context here so it's more relevant to you when I need to sort of course correct to something that's more accurate in terms of the health information. I do applaud my patients for looking that information up. But, I think that is going to be really important for us as providers to, number one, take time to understand what they're experiencing, what they are seeing out there, understanding those sort of various resources that are out there and what they look like, and then taking the time to kind of step back and provide true context so they get accurate information and we can provide the best care possible.
Right. And certainly that's something that it's a journey that we as a company have been on to make sure that as we provide information across a wide variety of mediums, that we continue to evolve in language, location, and give the patient the empowerment that he or she needs, knowing that there will always be that asymmetry.
Sure.
But if we can just give them relevant, accurate information, and I think it's on that accurate part that certainly we feel strongly about, and I know I'll bring it back before we close to the social media aspect, which is so much of what you said you saw in the study that you did with TikTok that you presented at ACOG was information that wasn't real information.
Yeah.
Any thoughts on what we can do about trying to mitigate that or counter that as an industry?
Yeah. I think there needs to be more of an emphasis, a real, true, intentional effort to go into those various social media spaces and provide accurate information. To be very intentional about, for example, colon cancer, and saying we are an authority because of who we are and what we do, and we want to provide you this accurate information on this health topic. It could be colon cancer screening, it could be prostate cancer, it could be diabetes, whatever. But being very intentional in these various, and I would say not, and I would emphasize across the various social media platforms. Because as you know better than me, that depending upon the platform, you're talking about a very different population. And as you think about the various platforms and who their specific populations are, again, being mindful about targeting the health issue to that relevant population. And so if we find that a certain age group is in this space, making sure it's health issues relevant to them and so forth and so on. But I think we can't just rely on it to happen in a natural way. I think we know that when we do that, there's going to be some things that are accurate and things that are not. And so one way to sort of mitigate that is for us, the people who have the knowledge and the authority to go in there and do it the right way with the right information.
Totally resonates that there are these lots of points, plural, of contact for the patient. And It isn't about telling patients stay away from YouTube or TikTok.
Right, yeah.
They're going to go.
Absolutely.
And they're going to get information from their mother-in-law, their pastor, their barber. They're going to get information in your office, in your exam room, on television. And so the point is, how do we give them, as you say, authentic, credible, contextual information to help empower that conversation so you can steer them to better health? I want to make sure I give you the last word. For the viewers that watch that are largely in the healthcare communications business, any thoughts on roles that those folks can play, advocates that they can be as you take this group on this journey?
You know, I don't know if my answer will surprise you, but I think they need to have some conversations with you. I think that there are very few, and this goes back to the comment I made early on, you know, there are very few entities that are willing to invest in this work the way you all have. And quite frankly, if there are other, so my message to your peers in your space would be to look at the example that you all have set. If you look at the things you post, the work that you do, if you look at your magazine, you all have really embedded health equity in everything that you do, from the way you make Health Monitor, the way you behave as a person who hires, the way you think about health equity and health literacy, the way you funded work in this space. That is really where, you know, the biggest impact can be made by your partners. And so my example, my recommendation would be to look at what you all have done and think about how can we be as impactful in this space? How can we be allies to move this work forward in a positive way, knowing what these issues are? And how can we begin to embed ourselves and embed equity in the work that we do in the way that you guys have?
Well, you're so gracious and kind. I appreciate that, and thank you. But for us, it's really about supporting you as the real hero and the patient in your exam room with you as the two heroes in the drama, and propelling them to a better outcome and a better understanding of the issues impacting their health. The thing that personally for me drives me is I don't want to have a spouse coming home and turning to their partner and I'm not sure what the doctor told me. I'm not sure what happened to me. I'm not sure why I'm taking this medicine. So that's what drives our company. That's what gives us purpose. And certainly it's why we want to be affiliated with you for the long haul here, so that we really learn the right places, the right ways, the right vocabulary to continue to have these conversations and drive for better outcomes. Thank you for spending time with me this morning.
Thank you.